Hello friends, we are into the second session of our discussion on medical research fundamentals, and today our discussion will be about how to formulate a research question, the hypothesis and the objectives. Looking upon into a broad way of the life cycle of the research, it starts with the identifying of the data needs. And then we'll have to spell out our research question and formulate the objectives which we are going to derive from our study. And then we have to plan which analysis we are going to take for our research, and then prepare the data collection instruments, like via which we are going to collect the data, whether it is some registry or some questionnaire or some interviews, like that. Then we go on to into the collection of data, and after collection of the data, we analyze it and draw a conclusion from the analysis. And now, after the conclusion, you are formulating a recommendation which you will have to inform the clinicians or the concerned persons who are in contact with the patient treatment. And even though all the researchers cannot answer all the questions or all the objectives which were planned before the starting of the research, so even if after coming to the conclusion there may be some more unanswered questions in this research, and that might be a platform for the next research, and this cycle goes on. And what is a research question? Research is something but an uncertainty or data needs about something in the population that the investigator wants to resolve by making the measurements in the study population. And so the clear research question should be framed like to choose the most optimal design, or to identify who should be included and who should be excluded. And we also have to keep in our mind about the outcomes, what we are going to get, and when the outcomes need to be measured. And all these things we have to keep in our mind before formulating a research question. And the ideas which we are having to find out the answers should be formulated into a question form, what you call as the research question. It begins with general uncertainty about a health issue. It may be a broad topic like for example diabetes mellitus, and after that you have to narrow down to a concrete researchable issue, like if our for example when we are planning to start a research, we should not directly go into what question, what issue we are going to concentrate. We have to first think of what is our area of interest. For example, if we are if we are interested in endocrinology part, that is, endocrinology is the broad topic, and in the endocrinology part what we are interested, like for example diabetes mellitus, and diabetes mellitus is even though a broader topic, and in the diabetes mellitus we have to choose, like for example regarding the reduction of complications. Okay, this we have narrowed down to reduction of complications. We have to even more narrow down, like for example whether the exercises bring about a reduction in the complication of the diabetes. We have narrowed it even more. And exercise is very broad. For example, exercise, there are a lot of exercises, and who we are going to see, and what time period you are recommending for exercises which you are going to study, like that. So we have to narrow. We have to then, for example, the final answer or the final research question would be whether a dedicated exercise of at least 40 minutes per day brings about reduction in the complications of diabetes mellitus in diabetic population aged more than 60 years. So this is almost like very clear and telling all the process which we are going to do in the research. For example, we are going to see about the research, exercise and its effect in diabetes. We are going to see an exercise of at least 40 minutes per day, and that too in population more than 60 years. So it should be very clear like this. And in the process of translating the uncertainty to a research question, We have to frame the problems in specific terms. For example, it should be in a clinical term or a public health term. It should not be a layman terms, because we are talking about medical health research, and we should focus on one issue at a time. It might be practically not possible to conduct on all the issues. Even if you are taking all the issues, you might not be able to do a dedicated work to one issue particularly like that. So we have to always focus on one issue, and it should be in everyday language. Like, it should not be so hi-fi that a beginner who's reading will not understand that research. And we can use more than one operational verbs if needed, and we should link that question to the potential action that would be taken once the question is answered. It should be something which is applicable and is stated as the question, which might be more interesting for the readers to look into the research. And the research question sets out what the investigator wants to know and not what the investigator might do. You should not directly tell what you're going to do in the research question, because it will come under the methodologies. Like, it should say what the investigator wants to know, and what the results of the study should not also be answered in the research question, because it will break the suspense of that research. And ultimately, everything should contribute to the particular field of science. And the sources of research question, like, from where do you find those research questions? Like, you can get it from the literature which is already being published. Like, we have to review the works of others in the field of interest. Like, in nowadays we have lots of sources like PubMed, Google Scholar, and so on. So you have to look on to those literatures which have already been published, and then we have to look on what is our area of interest, and then we have to be alert on the new ideas and techniques. We ourselves will have some creative ideas, like, why can't we do like this, why can't we do like that, why is that done like that? So many questions. Like, those questions you attain by attending research meetings and conferences in our field. And we should when we have a skeptical attitude about prevailing beliefs, like, some people may be like, they will not believe some conventional ideas, they want to know why it is followed and then follow it. In such ways, you can get some questions that we can make into a research question. And some other things, like applying new technologies to old issues. In this advanced world, we are inventing new technologies, and inventing of those technologies are not useful unless it is applied on something. So that way we can get the research questions. And some people have some imagination roaming, like some questions which we get from our careful observations in our day-to-day practice, or in teaching, or tenacity. So those ways we can get some research questions. And via a good guide or a mentor also, we get some research questions who are already experts and legends in the field, and they give some ideas to find out some unanswered questions. Now, the categories of research questions we can broadly classify as descriptive questions and analytical questions. Throughout the discussions of this, we will be coming across this descriptive and analytical parts. And broadly saying, these descriptive questions are those which involve the observations to measure the quantity. And the main eye-catching difference is that in descriptive part there will be no comparison groups, and in analytical part there will be some comparison groups or some interventions or test to test a hypothesis. And this description questions will help us to generate a hypothesis, and this analytical questions are those which we are using to test a hypothesis. That is the broad difference between these two. And the steps in conceiving a research question. It is not so easy to frame a research question in a single day. It takes a lot of days. And starting with, like, we will review of the state of art info. Like, for example, what is the lack of knowledge in any topic which we are choosing. That we'll have to analyze. Then we have to raise a question among ourselves first, and then we have to modify that, and to finally refine the question with specific details. Like, here we'll be looking on into the example which we already saw. Like, for example, we are reviewing some articles and journals. There we see there we look upon like many researches are made on the exercises and diabetes mellitus. So we have to know whether the exercise in diabetes mellitus daily will reduce the complications or will reduce the fasting blood sugar levels. That is the question we are raising in our mind. And then we have to decide what investigating by the peer review. Like we will have to get some idea about from our seniors and the experts, maybe our head of the department or our assistant professors or some colleagues. You have to discuss with them like to know whether it is worth to take that topic and research on it. And we'll have to like get some broad idea about how much will be the level and what is the type of blood sugar it will reduce, what is the frequency of the exercise, what is the intensity and duration of the exercise to be done to achieve that goal, and what are the risks and other benefits of making the diabetic people do this, and all those things. And then we'll have to define the measurable exposures and outcomes, what we are measuring, how you will know that the complications are reducing, how you will know that they are getting benefit from the exercise, what you're going to measure. Like for example, in this case you will have to take the FBS you are taking as a tool to measure whether the exposure, that is in terms of exercise, has caused outcome, that is reduction in the FBS. And then we have to sharpen our initial question, like we have to refine it after deciding which will be your type of study. Like for example, whether it is a descriptive study or an analytical study. If you're taking some descriptive kind of study, then your question would be, what is the extent of walking practiced by type 2 diabetes mellitus patients regularly? Like you're taking only the diabetes mellitus patients and you're studying on them. That is, there is no comparison group. So that study will be your descriptive study, and your question also will be a descriptive question. And if suppose you're doing an analytical study on the same, your question will be like whether brisk walking by diabetics for at least 1 hour daily reduces FBS levels as compared to those who do not. That is, there is comparison group, and this is an analytical question. A good research question should have a criteria, like finer criteria. Finer stands for F for feasible, I interesting, and novel, E ethical, and R relevant. Like those are simple English terms. You will know the meaning of the terms itself. Feasible is like whether we have adequate population to study on it, whether that study is feasible, or whether that question is feasible to answer in that present study population. And then it comes the interesting. Then whether it is novel, like whether it confirms or it reflects the old ideas, or it extends to prevent the complications, or whether it is providing any new information, or whether you are repeating the same thing which other publishers have also already done, like that. Then ethical, it is like it should not harm the population. And relevant, whether we will be contributing anything really to the literature of doing that study. And now the research hypothesis, like a specific version of the research question is the research hypothesis. It summarizes the main elements of the study, like samples, exposures, outcomes, like that. It establishes a basis of the test of analytic statistical significance. And it is stated for analytical questions with comparison groups. For example, research questions with terms like this is actually what to tell, simple words, but don't stick on to this stigma. Like if the question is having greater than, less than, leads to, compared with, like for example, the concept is that the analytical part will have some comparison group, that's it. And whether the purely descriptive questions do not require hypothesis, because what you're doing is actually generating a hypothesis. So for a descriptive question you will not actually need a hypothesis as such. For example, among the type 2 diabetes people who do brisk walking for at least 1 hour daily results in average reduction of 10 milligram percentage of FBS level as compared to those who do not. This is what kind of question? This is actually an analytical kind of question. And this we saw what is a hypothesis, like that is a part of the research question which we are going to further on expand in the study. For a good hypothesis, it should be very simple, specific, and stated in advance. Like before doing itself, you should know what is the hypothesis you are going to test, or what you are going to generate. Or and simple terms, it should be one exposure, one outcome, and it should be specific about the study participants, and it should be stated in advance, like written at outset itself and focused on the primary objective. Translating a research question to other objectives. It includes framing in scientific or epidemiological terms. We should take the question in a limited access. We should write in scientific or epidemiological language. Make use of not more than one verb for each, and sort as primary and secondary objectives. And be clear about the type of questions, like whether it is a descriptive questions. In this case, you will use the word estimate, like you are going to measure some quantity. And in analytical questions, you will use some word like determine, because you are going to test a hypothesis. So these such words and languages and vocabulary you'll have to improve to write the objectives and questions. Like as a summary, we'll see like whether some statements are correct or not. Starting with, but if you are telling determine importance of sedentary lifestyle among the diabetes, like this is a kind of descriptive question, like what are you going to determine. It is just a play of English words purely, and they sometimes can also overlap, but to make your I mean like thesis very professional, you will have to use these such terms. Okay, thank you. We are at the end of our second discussion, and see you all in the third discussion, which will be about the literature review. Thank you.